Okay, we're live.
Thank you, everyone, for joining us today for the first meeting of the current iteration of the Joint Committee to End Homelessness. I'm excited as the new chair to host this first meeting, this first briefing. We have some really important presentations that are going to help us further our mission to actually realize the potential and the goal of this committee, which is to end homelessness, which doesn't mean to decrease it. It means our goal is to be number one in the country and end homelessness in Maryland, and we want to be at the forefront of all of that. I want to thank all of the members of the legislature that are here, Senator Clarence Lamb, Senator Arthur Ellis, Senator Karen Lewis Young, and Delegate Sandy Bartlett. Have I missed anyone? All right, then without further ado, we are ready to begin. We have an ambitious agenda today, and we are going to begin with a presentation that we think we're going to ask you to limit the presentations to 10 to 15 minutes if possible, so that there'll be time in the end for members to ask questions. So we're going to start with Secretary Jake Day, who is the current Secretary of Housing and Community Development for the state of Maryland. Secretary Day.
Madam Chair, so good to be with you. Can everyone hear me okay? Okay, great. If I understand correctly, there we go. I was just about to ask for that. Excellent. Really good to be with you and your fellow members of the Joint Committee on Ending Homelessness. For the record, my name is Secretary Jake Day. I lead Maryland's Department of Housing and Community Development, as you noted. If we can jump to the next slide, I want to introduce someone who has been with the state of Maryland for a while, but has worked in Maryland for many years, including in Baltimore City, addressing homelessness. Danielle Meister, who recently became the Assistant Secretary. I guess it wasn't that recent, but it's new to the committee, Assistant Secretary for Homeless Solutions, which is a new position leading the newly created Division of Homeless Solutions. She's charged with developing and leading Maryland's strategy, policy, and interagency efforts to prevent and end homelessness. And I will also note that DHCD has once again resumed the chair position on the Interagency Council on Homelessness. I serve as the chair, something that I thought was really critically important to getting our agency in the position to lead as Maryland's housing agency, as I believe housing addresses homelessness. So if we can jump to the next slide. All right, so homelessness is the downstream outcome and effect of many larger and more systemic challenges that compound upon families. And those include lack of housing and lack of affordable housing options, losing employment or income. There's definitely an economic facet to all homelessness, increased cost of living to meet basic needs, limited access to adequate health care, predatory, or at the very least, in the best situations, turbulent rental conditions, lack of tenant protections, which we're all working to address more and more, and many other facets of a complex system that fails people, or a series of systems that are currently failing many people. Our work must focus on homelessness and on making homelessness rare, brief, and one time. Rare in that we must make robust efforts to prevent homelessness, including tenant protections, emergency rental assistance, increasing the number of affordable housing units available in the state, access to wages and to work that can pay for that housing, creating pathways for individuals exiting institutional settings like foster care and move directly into housing instead of through homelessness. Making it brief such that if someone becomes homeless, is homeless, we help them as quickly as possible by reducing barriers to high quality shelters and services, ensuring that access is inclusive and equitable. Foot stomp there, that's going to be a key priority of our department in the coming year. Rapidly connecting individuals to permanent and stable housing in the community and coordinating street level outreach to increase awareness on services. And third, as I mentioned, one time, making it one time, ensuring that once someone is rehoused, they stay housed. They're provided with financial assistance, supportive services, wraparound supports necessary to avoid a return to homelessness. That is sadly common for those who experience homelessness, that they remain in that system or become unsheltered again. Solving this incredibly complex set of issues requires dedicated leadership, including dedicated executive leadership and legislative leadership, with clear public commitments to prioritize homelessness prevention and solving homelessness. It takes a deep level of partnership, alignment, collaboration across all sectors, federal, state, and local, outside of the housing systems, into healthcare systems and institutions, philanthropic and nonprofit organizations, and community stakeholders as well. To strengthen these partnerships and build on their capacity, we decided that we needed a division within DHCD, that Division of Homeless Solutions, and then it needed to be elevated to the assistant secretary level, such that the person responsible for addressing homelessness within the state of Maryland and within Maryland's housing agency was at the table with DHCD's leadership and had a much clearer path to the governor and the General Assembly in addressing these issues, and be the senior leader within government on the issue of homelessness. If you jump to the next slide for me. We are already seeing results, measurable results. DHCD has secured $5 million in new federal funding to prevent and address homelessness as part of Governor Moore's housing package, which you and your colleagues passed. Thank you so much. The Renters' Rights and Stabilization Act was signed into law, creating a new Office of Tenant and Landlord Affairs, which assists distressed renters that are in danger of homelessness, thus contributing to the prevention of homelessness. So many other things that you included there in the passage of that bill help to reduce barriers to being housed, including the significant reduction in the cash that someone has to come to the table with in order to rent, in order to move into an apartment. Maryland is extraordinarily expensive place to live. And so you help make that better by capping security deposits and other fees at 1 month's rent total. Initiatives like the new Community Schools Rental Assistance Program the General Assembly created are part of overall efforts to foster a more coordinated approach to integrating education, health, and aging and disability and housing resources across state and local levels. So we're strengthening our partnerships with local COCs and service providers, and providing financial and technical assistance for those that are the boots on the ground. They're doing the work in communities with homeless individuals and families. Next slide, please. And we have created and are implementing Maryland's first comprehensive permanent supportive housing strategy, which includes adapting regulations for low-income housing tax credits and state rental housing funds to prioritize permanent supportive housing. You're going to see more of that in the QAP as it's released this year. Expanding the use of Medicaid to support homeless prevention, and exploring new federal resources and initiatives. As directed in the House Bill 577, we are developing a certification process for homeless shelters, a process that will help with the equitable access to shelter, and a process that will leverage the department's renewed data-driven focus. If you'll jump to the next slide for me. Lastly, DHCD is developing a homeless services data warehouse. This is part of an overarching data access, transparency, and improvement process that we're working on. But specifically on homeless services, this will consolidate client-level data on homelessness from all 10 continuums of care across the state, enabling state administrative data matching and system modeling for shelter and housing investments. And we designed and implemented a new coordinated entry system. That's the assessment prioritization process for homeless housing and services. And we intend to train our COC partners on collecting quality data, housing assessment and placement systems, and resource prioritization. We also implemented an intensive annual project and system level performance review for homeless solutions program funding, and reviewed state funded shelter projects for compliance and also for capacity. That's part of our look into the next year. And these ongoing initiatives are going to help Maryland maintain its improved homeless system performance outcomes, including a 20% increase in people exiting to permanent housing and decreasing the number of days a person experiences homelessness by 14%. So to give you the details on that, our implementation, I'm pleased to introduce DHCD's Assistant Secretary for Homeless Solutions, Danielle Meister.
Okay, thank you. And thank you for having us, Chair Carter and members of the committee. So let's go to the next slide. So Secretary Day mentioned we have what are called continuums of care in our community. Across the nation, there's 400 of them, and they are established and designated by a HUD process through congressional authorization. These are the local regional bodies that organize homeless services in their community and thus are eligible to apply to HUD directly for funding. And they have certain responsibilities. So within Maryland, we have 10 of those. We used to have 16 as of 5 years ago. And in the past 5 years, we've been working with local partners. We created and merged a new continuum of care called the Balance of State to help bring more administrative capacity and tools to rural areas. So for those jurisdictions that you see in navy blue, those are jurisdictions that we play a much larger role in the Homeless Services Administration system. So we actually run their day-to-day client data system. We organize a lot of their point in time counts. We develop strategic plans. We organize the housing resource system in those parts of the state. So we play a much bigger role there, but the other 9 COCs generally cover one county with the exception of the Midshore and the Lower Shore COCs. Next slide. And so we're going to talk a little bit about data today. So there's 2 ways we use data when we talk about homelessness. One is annual point in time count data. This is something that HUD requires every community to do every year. It's conducted in the last 10 days of January, and essentially it's a street canvassing and survey system for people who are living in an unsheltered location, an emergency shelter, or transitional housing. Those are the settings that meet sort of the HUD definition of homelessness. So communities go out, they do these canvassings. They also collect data from domestic violence service providers who cannot participate by law in the local homeless management information system. And they put together an estimate of who's homeless on one given night. So it's an incomplete data set. It doesn't capture the full year-round perspective of people who come in and out of the homeless system at different times. It's just a snapshot. The other way we measure data is through our homeless services information systems. HUD requires every continuum of care to collect client level data for anyone who's enrolled in different programs. Generally, those annual services data in HMIS, it captures about 85% of all the homeless shelter beds and transitional beds in the state, and generally about 95 to 100% of permanent supportive housing, street outreach, and other interventions. So it's a very good representation of who experiences homelessness in a year. And every year we receive data from COCs that they collect at the local level. They also contribute that data to HUD. And we also, as Secretary Day mentioned, are working on our data warehouse expansion, which would pull all 10 COCs client level data into one place so that we can do more robust analysis, care coordination, and administrative data matching to better understand how we can improve our response to homelessness. Next. So this is our snapshot data. This is the one night of year. What does it look like for people who are experiencing homelessness? So in the most recent count that we have public data available for, that was conducted in January 2023. HUD is still certifying the results of the 2024 count, so we don't have those available yet. But for 2023, the typical night, there were over 5,800 people experiencing homelessness in the state of Maryland. Most of those people were staying in a sheltered setting, either an emergency shelter or a transitional housing program. And a portion were also unsheltered, so living in a place not meant for human habitation, outdoors, in a car, and without, a typical house or a shelter safety setting. So since 2015, which is sort of, we use 2015 as our baseline year for the PIT because that's the year HUD made a lot of changes to methodology at a national level. So if we look back over that 8-9 year period, we've had a 30% decrease in the point in time count in Maryland, which does not necessarily mirror what's happening at the national level. At a national level, we're seeing sharp increases and upticks in these numbers. Next slide. So this is what our annual data looks like. This comes directly from those homeless management information systems that the COCs operate. Over the course of a year, we serve about 21,489 people with different types of homeless services, ranging from street outreach to emergency shelter to transitional housing. When you break that out into the population types, about 6,200 of those individuals are in a family with children. So it's a 1-2 parent household, maybe multi adult household, intergenerational, that has at least one minor child within the household. But the vast majority of people are adult only households, either singles or couples. And next slide. And then these are just some demographic trends we wanted to pull out to highlight some of the emerging issues for certain populations. So we have a comparison here. There's a historic change, which is from fiscal year 18 to 2024. Obviously, with COVID, we saw a lot of 1 to 2 year fluctuations in data. And so when we think about more recent term change, we always try to compare fiscal year 22 and forward because those are relatively normal years. 2020 and 2021, the data that was collected during that time due to COVID was really challenging and just very unusual conditions. So as we look at the last couple of years, we're seeing a couple of increases. We have seen an increase in adult-only households as well as families with children. The number from 2020 and up is we're getting back to pre-COVID days in terms of homeless numbers. We have, on the good side, seen some reductions in people with disabilities and folks who are chronically homeless, kind of indicating that the way we're prioritizing our housing resources seems to be working. We generally prioritize those for people who have more severe needs, more vulnerability, and more acuity. We've continued to see a really sharp decline in veteran homelessness. Oh, sorry, if you can go back a couple of slides. Yep, thank you. We've seen a continued decline in veteran homelessness. This is probably the group we've seen the most progress with over the last 10 years because of really deep investments from the federal government in housing resources for veterans. And so we've had a 31% reduction over the last 7 years, and more recently, a 3% continued reduction over the last couple of years. Over the last few years, we've seen some increases with unaccompanied youth. Although in part, we think that might be also due because there's been an expansion of funding and services for that group. The state has invested heavily. We've tripled our investment in youth homelessness in the last few years. So the fact that we're collecting more data on youth, that could be part of that. One area where we're going to be doing a lot more work is around older adults. You can see there's sort of some scary trends here. This is the first year we've had data on older adults and their experiences of homelessness. And it's very clear that older adults are becoming a growing population that needs a dedicated set of solutions and policy priorities. So you'll be hearing a lot more from us over this next year as we develop our strategies and goals with different agency partners. But in particular, we want to highlight the needs of older adults who are 65 and over because that is the fastest growing homeless population as of today. And then we are seeing a small uptick in first-time homelessness. This is sort of expected as we're moving people through the system more quickly. We are able to serve more people than we have before. If you can go to the next slide. One question you might be asking yourself is, if our point in time count number is going down every year, our annual service data is going up every year. How is that possible? Homelessness is growing on one data set and decreasing on another. So one thing that is important to look at is context. So as we look at our system performance measures, we mentioned that the average length of time someone's experiencing homelessness is going down. We also are getting a lot better at permanently housing people faster. And so when that happens, we have faster turnover in shelters. Those beds open up. We can serve more people over the course of a year. So that's just a helpful tidbit to understand those different data resources. We generally have seen the largest historical drops in homelessness during the COVID period. So when eviction moratoriums were in place, when we had emergency rental assistance widely available across the state, we did see large reductions in the number of people that came into shelter or were in a street outreach program, indicating they were unsheltered. So we have seen a lot of progress in those years where we had more tenant protections and more emergency rental assistance. We are at this point returning to pre-COVID levels of homelessness. So our data this year shows that we're kind of right back at fiscal year 19 with a slight increase. So we're going to be monitoring our trends in this way and really making sure that we're taking aggressive action to prevent that number from growing even more. And then the last thing I want to highlight is racial equity. So there's a lot of challenges with homelessness, and there's a lot of disparities out there that we're all trying to address in our different kinds of work to support families. But in the homeless world specifically, we have some really stark inequities and really stark issues around who experiences homelessness. So while 31% of Marylanders are Black, over 60% of the people who are homeless are Black. And we don't necessarily see those disparities for other racial groups. So that's why we pull out specifically Black households. But as we develop policy and funding solutions, we really have to look at everything through a racial equity and cultural competency lens and unpack and address those really historic systemic barriers around racism that are contributing to these households being more likely to experience homelessness than others. Next slide. So we just want to highlight a couple other key challenges and concerns. A lot of this is coming out of new data that we have access to, but one thing that's become really clear is while for many years we've been focused on increasing housing opportunities, we've been focused on helping our systems work faster, we have a really big gap on the income side. And what are we doing to support individuals with maintaining or increasing that income, whether that's employment, benefits, unemployment, retirement, pensions. And so when we have people coming into the homeless system, we're seeing some really big gaps. 48% of homeless adults and 68% of all disabled adults have zero cash income. They report they have no resources when they come into the homeless system. That includes even benefits like cash assistance or disability benefits. And so that's a major issue we want to address this next year. Another indicator we're looking at is enrollment in public benefits. And we're working collaboratively with DHS and other key partners to hopefully address this issue this upcoming year. But 50% of homeless adults don't receive any public benefits, whether that be SNAP, TANF, or WIC. And 31% of homeless adults, they report they don't have health insurance. So they don't have Medicaid, they don't have the Maryland Children's Health Insurance Program. So we'll be looking at benefits, income, and employment really closely over this next year. The other big challenge we're facing in the homeless services world is just the sheer number of people we can serve. So fair market rents have increased 41% in the last 3 years in the parts of the state where we have the most homelessness. And that is significantly impacting the number of households that we can serve, whether that's through the state homeless solutions program dollars or it's through those local continuum of care managed funds. And so any year that there's level funding, whether that be from HUD or the state or local governments, it's actually a cut because the cost to provide these rental assistance programs, these services to folks is going to go up every year. But we've seen the most dramatic increase in the last 3 years. And we've been lucky enough to have COVID era resources to deal with that through the Treasury Emergency Rental Assistance Program, through ARPA funds, state and local recovery funds. But those are now coming to an end. And so one issue we are grappling with is how do we maintain the same level of service despite these resources going away, and also hopefully increase. And then one concerning thing that has come out of some preliminary data we're collecting, for the first time in 5 years, we are seeing data that indicates the number of people who are being served by permanent supportive housing is going down. So after a 10-year increase, for the first time this year, we saw a reduction in permanent supportive housing beds. And we think this is largely due to those increases in rent. Most of the permanent supportive housing across the state is tenant-based, meaning they're renting from a private landlord. So as those rents go up and the budgets stay level, we have less and less people we can serve. So that's something that we're going to be working on as well. And then the next slide, I'm not going to go into any of these in detail. I just wanted to let you know we have some additional data tables in the back for everyone's reference. And this breaks out our data by continuum of care. So you can see some of the differences in local and regional numbers. And that's it for us.
Thank you very much, Ms. Meister and Secretary Day. Is it okay with the committee if we get through the presentations and hold all questions until the end so we can make sure we get through all of the presentations?
Sure.
I apologize for making you hang around, but if you would be so kind, I'd appreciate it. So with that, we're going to move on, and thank you for that thorough presentation. We're going to move on to the Baltimore City Mayor's Office Director, Ernestina Simmons. Director Simmons, you're up. Please.
Good afternoon again, everyone. Thank you very much for having me. This is my first presentation, so please be kind to me as I go through the slides. Please let me know if it's helpful for me to share my screen or if you'll move it up. Thank you very much. Next slide. So the Mayor's Office of Homeless Services has two different responsibilities. Number one, we serve as the collaborative applicant for the COC for the City of Baltimore. But the second area, we are responsible for a lot of services for the city. And so what you're looking at on the screen is our portfolio includes about 60 million in funds from both COC, HOPWA, ESG, HSP funds, as well as general funds. General funds from the City of Baltimore helps to support our street outreach teams as well as our emergency shelters. Some of the other items that we are responsible for is the coordinated access team. We're responsible for HOPWA. We run permanent supportive housing, rapid rehousing programs, YHDP with its youth homelessness demonstration projects, and the HMIS system. Next slide. What I've listed here is simply for you all to have a better understanding of what our funding sources are looking like for the City of Baltimore, as well as the dollar amount for each of those funding streams. Overall, we have about $60 million in funding that we receive on an annual basis to support a lot of the programs and services we're going to talk about today. Next. Danielle has talked about systems performance measures. What I wanted to do with this group is give an opportunity to kind of go through what this looks like for the City of Baltimore. Next slide. We've taken a look at our systems performance measures from 2019 through 2023. And the way that the systems performance measures, it allows us to take a look at each year and how our community has fared in terms of serving clients. One of the items, so the first measure is the length of time. Taking a look at 2022, we've been able to decrease the length of time that people have experienced homelessness in 2023. The same thing looking at the returns to homelessness, we've decreased by additional 2% of looking at what's the data telling us for our people coming back into homelessness that have exited. The third measure is those that are experiencing homelessness in 2023. We've seen 2,349 people that are experiencing homelessness, which was an increase from the prior years. The growth in income, one of the items that HUD wants us to look at is, are people better off when they're exiting your program? Are you helping them to increase their earned income? And so in 2023, that data point for us was for 35%. The graph that you're seeing above is we looked at what are the national averages and how are we comparing against other cities. So you're able to see how Baltimore City is faring, what's the national averages. I think Danielle had mentioned there are 400 COCs across the US. And so we wanted to understand just better. We really wanted to understand how are we faring in comparison to other cities. Systems performance measures number 5 is looking at who's in your system for the first time. They're experiencing homelessness for the very first time. In 2023, we have seen the increase in those that are experiencing homelessness for the first time. The item that our community is intentionally focused on is number 7. We want to look at how many people are exiting from the street into housing. When we look at how other communities are faring, our community has not done well in this measure over the last several years. 2023, we were at 13%. And what this measure is allowing us to do is let's look at the services that you are offering to people that are experiencing street homelessness. Are you able to have a system that's going to be able to serve them with what they need at that point in time. And that does look like our navigation process, our prioritization. How are we treating people from the access door? Am I getting you housed? Is what this measure is allowing us to take a look at. And so as a community, what you're going to see in some of our later presentations is a better understanding of who's in our shelter system, a better understanding of how many people are we encountering through our street outreach teams, as well as our emergency shelters. And a lot of what we see as a community, and you are hearing the background noise of the city, so I apologize for that. A lot of what we see as a community is we just have to do better with our access points. If we're going to create a space where people that are experiencing street homelessness, that are chronically homeless, sometimes our shelter is not the solution. We need another pathway, oftentimes that's going to allow for us to meet people's needs. The next measure is looking at the exits to permanent housing from emergency shelters, transitional housing. And as you can see, our community has fared better in that area over 2023. And the last one is the retention in permanent housing. This community has done very well as it relates to people that's exiting from permanent supportive housing, and are they able to retain in housing? Next. We've pulled out the 2023 point in time data for Baltimore City. And so on that point in time in 2023, we had 1,551 individuals. The unsheltered count was 113 and the sheltered count was 1,431. I'm going to point out the side that lifts up the amount of clients that was chronically homeless, veterans, and the youth that are ages up to 24 for this group to just be able to take a look at. 65% was men, 73% was Black and African American. And the grids below that is just showing us what are some of the health conditions, whether it's mental health or substance abuse, or those that are living with HIV or domestic or survivors of domestic violence. What's that data telling us about the people that's entering our system and asking us for help and support? Next slide. This is a breakdown of 2023 as well. We've listed out just the age demographics for the group to be able to see. We've separated the unsheltered, transitional housing, just so you all can get a sense as to what are these age groups looking like for those that are in the shelters, those that are unsheltered. What you'd be able to see is 52% of the population was between 35 and 54. And over the age of 65, it was 4% for that period of time. But when we go to the next slide, I apologize. This is our 2024 data. This is 2024, we conducted a sheltered count. We did not conduct an unsheltered count. So our numbers was 923, which is really the lowest sheltered count that the city of Baltimore has had from when I am able to see it. I'm looking back as far as 2019, and from 2019, this is the lowest shelter count that we've had. But when we take a look at those that are experiencing chronic homelessness and veterans homelessness and youth, those are increasing in our community from the 2023 data. In 2023, that's a 4% increase in those that are experiencing chronic homelessness. That's an 8% increase in veterans that are experiencing homelessness. And that's a 6% increase for youth that are in our system that's experiencing homelessness in 2024. Next slide. And again, this is a further breakdown by the age and the demographics, as well as for us to see what are some of the conditions of those, the barriers that they are listing in their assessment as to what we're seeing. 30% are reporting mental health, 22% are reporting substance use disorder, and then you can see the trend in the data as well as the age demographics. Similar to what Danielle has pointed out, we are also seeing this increase in elders entering into our shelter system. And being able to create a response that meets that need is going to look a little bit different. Oftentimes, our shelter systems is designed, you must be able to meet your activities of daily living. If you are a senior and you have chronic health conditions and you can't take care of yourself, there's often not that many spaces for people to go to get resources and support. So that is an area of need in our community as well. Next slide. Next. We took a look at our LSA performance data to compare it from 2023 and 2024. In 2024, we was able to serve 120 additional clients from 2021. So we're seeing an increase in the total amount of clients that we've been able to serve, but keeping into consideration for us, we also have a really great relationship with HABC, and we have additional housing in units as a part of our inventory. So this is not just inventory, that's COC inventory. We have other programs that's a part of the city's inventory, and that is what's accounted for in these total households that are being served. Next. I'm always trying to help people understand our shelter system because it is one that we are seeing a tremendous amount of need just across the board. So what you're looking at here is our shelter system. One side is 10/1/22 through 9/30/2023, and the other side is 10/1/2023 through 9/30/2024. When you're looking at emergency shelters as a comparison, we had 883 in 2023 versus 1,226 in 2024. What emergency shelter entry and exit means, those are year-round beds that was available for those that was experiencing homelessness. When you're going down and you're looking at emergency shelter night by night, this is looking at in 2023, we served 2,020. In 2024, we served 2,275. During the winter shelter season, our commitment is to ensure anyone that is asking for a bed is able to receive a bed. And so this is able to help people understand how many people are coming to you asking for a bed when the weather is way too cold and our emergency shelter system is full. Our shelter system is full on a regular basis. And so this is helping us to understand that. And then the last category is our street outreach teams. You're able to see our street outreach teams have served over 4,488 people in the last fiscal year. And this is also helping us to see what is the difference in the age categories of who our street outreach teams is encountering. So as an example, you can see that adult ages 50 and over in 2023, our street outreach team encountered 1,450 adults over 50. And that percentage point is remaining consistent in 2024. And our grand total overall numbers, you can go to the next slide. You're good. Thank you so much. In the next slide, this is really just a graph of the emergency shelter. So we're able to see line by line of 4,488 people in 2024 versus 4,269, just providing a side-by-side comparison of the emergency shelters, the winter shelters, as well as our street outreach teams. Next. In Baltimore City, we launched an encampment protocol in 2024. What this encampment protocol was designed to do was to, number one, take a look at the encampments in our community, but we also put together a task force that's a part of that work. Could you go to the next slide for me? What this encampment protocol does is we brought together city agencies, so not just MOHS, it's also the next slide. I apologize. The next slide includes who's a part of the encampment resolution work group. It includes the fire department, the health department, Baltimore Police Department, DHCD, Departments of Public Works, and community-based organizations. What this team is charged with doing is taking a look at the encampments that are in the city, providing resources, support. It's targeted resources and targeted approach to encampments that have been identified in the city. One of the items that people talk a lot about our resolutions. It's not the resolution that we're focused on. We're really focused on the high level of engagement and the needs that we're seeing in the encampment sites. So as a result, one of the items that we prioritize with any resolution is we have to offer shelter. It's the number one item that we have to make sure that we have in place, regardless if we're going to do an encampment resolution. Services are at the forefront of that, as well as shelter beds is at the forefront of that resolution as well. Next slide. This is taking a look at what we've learned about our encampment protocol, some of the pros and cons, and some of the challenges that we've also had as well. We've seen an increased shelter acceptance. I think when we launched this protocol, part of the challenges for us was taking a look at those that were in encampments and experiencing street homeless. However, they were not navigated. It was not a part of our larger system for housing intervention. So part of this encampment resolution is also our way of trying to target being able to have tailored services, tailored approach, interventions, housing navigation, all a part of the work group and the team. Next slide. I've shared just a little bit about what this encampment data has looked like for us and what it's looking like in the city of Baltimore. So the first column is going to be able to walk you through how many encampments did we have in June, July, August, and September? How many encampments were we able to resolve? I just want to highlight that a resolution for us does not always mean we got to the end and we needed to have an aggressive approach to clearing the site. These are not encampment clearings every time we're saying that we've resolved the site. For us, our team is charged with engaging the site 30 days before we plan a resolution. And so oftentimes, the sites that you're seeing on here, we've only had two to three resolutions that have resulted in that the site was not clear before the day of the encampment resolution. So what that means is we provide notice, we provide targeted outreach 30 days before. And by the time we get to the final day, those sites have been cleared in the city of Baltimore. Next slide. I just wanted to highlight some of the items that we've been able to really work on and accomplish over the last year. So the first one in a lot of these initiatives was definitely due to the support of other offices such as DHCD, HABC, as well as some of the funding and support we've received from ARPA. So the first one is we launched a rapid rehousing program. And through that project, we were able to serve 126 additional households, with 86% of them remaining in housing after the completion of the rapid rehousing program. We was able to launch a shelter diversion program, which was unique for our community. We really haven't been able to spend a lot of time on figuring out how to divert people from coming into our shelter system. And so through the use of these ARPA dollars, we was able, thus far, we have spent a little bit over $1 million serving 265 households, diverting them from the system that we've been talking about today. In addition to that, the next one down there is the Housing Accelerator Fund. In collaboration with DHC and MOHS, what we've been able to do is use home ARPA dollars and home ARP dollars to create permanent supportive and affordable housing units. This grant was for $15.2 million. In the end of this, it led to 139 permanent supportive housing units in our ecosystem, as well as 151 affordable housing units in our ecosystem. Next. We have also been able to purchase 2 hotels, and everyone talks about the hotels, but really these hotels were about converting them to permanent supportive housing. We're extremely happy to report that Sojourner Place at Falls, which is being ran by Episcopal Housing and Healthcare for the Homeless, has effectively won this bid. What that's going to do for our ecosystem is to create 155 permanent supportive housing. And they have a vision of creating a medical respite center for the city of Baltimore. What that means for us is we do not have a medical respite center that's dedicated to those that are experiencing homelessness. So the clients that we're charged with serving often have nowhere else to go. So their proposal and their vision is absolutely what's needed for our city. The next one that we've been able to do is in our supportive housing projects, we funded Springboard Community Services, who aims to provide dormitory housing to youth ages 18 to 24. Pretty excited about what that program is going to do because we've seen an increase in youth entering into our system. And the other item, in partnership with DHCD, HABC, and Homes for America, we've been able to work on a site called Restoration Gardens. Number one, it is a permanent housing facility. However, through partnership, that building is now going to be prioritized for youth that's exiting out of foster care, which is just going to be a great opportunity to have another resource available for youth exiting care. Next slide. And then the last couple of projects that we're pretty excited about would be the adding of 36 public housing units with HABC. These are family units though. And so being able to add on additional units into our inventory is something that we're also pretty excited about. And in addition to, I talked a little bit about the Restoration Gardens project. We've poured $500,000 just into the renovation of the space to prepare it for our foster care youth. The building needed some renovations. And so through our opera dollars, we was able to support that. And then the last one is the Medicaid ACEs expansion program. Kevin is going to talk about that with Healthcare for the Homeless. What I will just lift up is that it's a project that has allowed MOHS to use public housing units with case management services, just strengthening the service delivery approach. Next slide. What's next for MOHS? We're really intentionally focused on decreasing chronic homelessness in our community. The projects that you're seeing here, we feel like they're going to be a key measure in our ultimate goal of decreasing chronic homelessness. We talked a lot about the hotel conversion project, but also DHCD has awarded MOHS $2 million that's going to be used towards this venture. We plan to launch a project that's dedicated towards chronically homeless, as well as folks that are entering our system for the very first time. And then the last one is we're looking to continue to strengthen this relationship with HABC. Is providing a ton of opportunities as we're just seeking additional housing opportunities for those that enter into our system. And finally, on the other side, our goal is to have 800 shelter beds. As we take a look at how did we decrease our number of clients that how did we decrease our number of point-in-time data for 927 people that are in shelter? It's because you need shelter beds in order to meet the immediate need for people to go into housing and everything else. Our community has not had 800 shelter beds in it, but ultimately, when we take a look at serving well over 2,000 to 3,000 people between our winter shelter in our year-by-year shelter, 800 beds will meet a third of who is seeking emergency shelter from our community. Thank you.
Thank you so much, Director Simmons, for that presentation. And I want to say that for a first presentation, you were extremely thorough. Hopefully, that might cut down on some of the questions we'll have at the end, but knowing this group, probably not. If you are coming in late, and I know that I saw Senator Benson and maybe some others, we are going to hold questions until the end. We only have one more presentation from Kevin Lindemann from Healthcare for the Homeless. So with that, sir, you're up.
Thank you, Senator Carter. And Director Simmons often says it's her first presentation, but she always does just a wonderful job. Kevin Lindemood with Healthcare for the Homeless. I will say, Senator, we are so uplifted. At the beginning of the committee meeting, you clarified the name of the committee. To end homelessness, not to manage it. And it's such an honor to be a part of this panel. I've been doing this work for about 30 years, and never have I seen the public sector leaders and private sector nonprofit leaders so aligned in what they are presenting to you about homelessness and how to end it. And never have I seen that happen before a legislative committee that is so strongly declaring that its goal is not just to manage homelessness, but to end it. You've heard the word partnership already an awful lot through these presentations. You'll continue to hear it. And I would say that that's also unprecedented, which is what, after decades of doing this work, makes me very excited about the opportunities that we face to really move forward some proven models. I'm going to share my screen. I believe I have the permission to do so. Can you all see that slide? Just a quick confirmation.
Yes, sir.
Thank you very much. So a little bit about Healthcare for the Homeless. This is our vision and our mission. The mission has changed from time to time over the last 40 years, but has stayed relatively the same, working to end homelessness through racially equitable healthcare, housing, and advocacy in partnership with those of us who have experienced it. We were established almost 40 years ago now by a group of people, 30 organizations throughout Greater Baltimore, many of them the names you would recognize. Johns Hopkins, University of Maryland, Family and Children's Services, Mercy Medical Center, Catholic Charities, St. Vincent de Paul, came together and wrote a grant. And out of that grant, Healthcare for the Homeless was created. 3 years later, we were incorporated as a nonprofit and became recognized. The research demonstration project proved to the federal government the Healthcare for the Homeless concept, and we became the model for the federal Healthcare for the Homeless program established in law in 1987. Today, we've grown into an organization of more than 200 staff, providing integrated healthcare services, medical, mental health, social services, addiction treatment, outreach, community health work, dental care across 5 clinical sites in Baltimore City and Baltimore County, serving 11,000 different people a year, providing supportive housing services since about 2001 for now more than 750 people, public policy advocacy on local, state, and federal levels. We've realized very early in our development that we couldn't just provide the best services that we could for people experiencing homelessness. We had to change the policies that were creating it faster than we can solve it. And then we became a housing developer right around 2019, recognizing that this wasn't a departure of our mission, but as I will discuss, very much a fulfillment of it. Housing being the very best way to both end homelessness and improve health. Here you see our service area. The darker areas is where more of the people that we are seeing are coming from throughout Baltimore City and Baltimore County. We helped to launch programs historically. If I was testifying before you a couple of decades ago, I would have talked about Frederick and Montgomery County. They've since become their own federally qualified health centers and are continuing to operate and serve people experiencing homelessness today. I will note, I won't get into a lot of demographics because they track some of the demographics you've already seen. As you might imagine, in a healthcare setting, we're seeing higher rates of illness across all of those levels. About 44% of our clients identify as female or women, and that has grown over the last 30 years. Particular growth in the percentage of Hispanic, Latino, Latina, Latinx clients that we have seen, doubling over the last 5 years and increasing even more than that over the last 10 years. 10 years ago, about 3% of our patient population identified as Latinx. And as you can see, 43% last year. This is our largest clinic site in downtown Baltimore along the Fallsway, most integrated. We also have a clinic on the campus of MedStar Franklin Square in Baltimore County and deep in West Baltimore in partnership with Grace Medical. We have a couple of shelter-based clinics that we're operating and a mobile clinic pictured here that goes throughout Baltimore City and Baltimore County where the need is. And we are finding incredible growth in need out of our clinic sites and into the community and trying to figure out more ways of increasing that mobile work. Why is there homelessness? We often spend a lot of time talking about personal failings. I will assert to you that homelessness is far more about structural failings than it is about personal weaknesses. Those broad structural causes, federal disinvestment in affordable housing. I think the secretary and his team certainly know that we're spending less than half of what we spent in 1979, adjusted for inflation, in housing assistance for lower income people. And we have been seeing the results of that over the last 40 years. Wealth and income disparity, systemic structural individual racism, insufficient public safety net, restricted access to healthcare. We remain the only rich country in the world that does not guarantee access to healthcare as a right of citizenship, if not also a right of residency, and extremely low wages and insufficient disability assistance that just don't allow to meet the cost of living and the cost of housing. You have up here the so-called housing map using federal data put out by the Low Income Housing Coalition that shows that in no jurisdiction in the country can a family earning the prevailing minimum wage. I don't just mean the ridiculously low federal minimum wage of $7.25, but even wages like in Maryland of $15 an hour, and the prevailing wage in any jurisdiction. In no jurisdiction can someone earning that afford housing at fair market rent. This picture here with higher costs of housing on the coasts, certainly Maryland is among that picture. Danielle earlier mentioned the homelessness data using the HUD definition. There are no fewer than 5 federal definitions of homelessness, and they do not all agree with each other. The stats that you heard were using the narrowest definition. The Department of Health, HHS, and agencies that they fund like ours use a broader definition that includes people who are couch surfing, doubled up with friends, neighbors, and relatives, which is, we would believe, how people would first experience homelessness. The Department of Education also uses a very broad definition that even includes families and children at risk of homelessness. But what you see here, if we were to map out the increase using the narrowest definition, over the last 2 years, there's been a 12% increase in homelessness nationally, and that is seen primarily in areas with the highest housing costs and the highest cost of living. They're virtually the same map. It reminds me of when we look at the redlining map, 100-year-old redlining practices in Baltimore and other cities, and we hold up health disparities. It's the same map, and it's very much the same map nationally. There is a gap. This is a national slide, but Maryland's numbers are surprisingly similar to this. They differ by a point or two. This is for every 100 households at income levels, how many units of housing are available for them. So extremely low income is less than 30% of area median income. 50% is considered low income. And you've got 80%, 100%. So at 100% of area median income, there's just about enough housing that people can afford. For people below 30% of area median income, there's only 34 available units for every 100 families that need them. So there is a great unmet need. In Baltimore and throughout Maryland, more than half of renters cannot afford, using federal standards, the homes that they live in. And this is extremely troubling and a driver of homelessness. As Danielle mentioned earlier, homelessness is rooted in injustice. About 31% of Marylanders identify as Black or African American, but 60% of Marylanders experiencing homelessness do. On the national frame, 13% of Americans identify as Black or African American, but 40% of those experiencing homelessness are Black or African American. And this is, of course, driven by centuries-old policies that continue to this day. We know that where you live matters. In some of the wealthiest Maryland counties, life expectancy over 82 years. You go sometimes just miles into some of the poorest and most segregated and redlined Baltimore City neighborhoods. You see life expectancy dropping, and dropping even further among those experiencing homelessness. People experiencing homelessness are significantly more likely than their housed counterparts to die prematurely. Study out of Boston shows that those living in shelter are 3 to 4 times more likely to die early than those in housing. If you live in a shelter, you're 3 to 4 times more likely to die early. If you live on the streets, 10 times more likely to die, driven primarily by acute and chronic healthcare problems and restricted access to healthcare. I want to hold up a couple of policy achievements that the General Assembly has seen through in recent years, and just say that in the field, on the ground level, they make such a difference. Restoration of adult dental care. I can't tell you how fantastic it is to see people actually getting access to dental care who had no access to it through Medicaid before. Medicaid coverage of pregnancy of pregnant people, regardless of immigration status. Because of this, we've had 96 healthy babies born through Healthcare for the Homeless OB services. We were able to launch an OB program because of this law. We can make it sustainable. That's in partnership with Mercy Medical Center. And some 340B program protections. This is a federal drug purchasing program that the General Assembly helped us protect last year. And of course, the Medicaid Supportive Housing Waiver, or ACES, Assistance in Community Integration Services. I'll talk more about that in a moment, as Director Simmons alluded to. Some opportunities we see, harm reduction. My goodness, I needn't tell this committee that overdose deaths are on the rise. There has been overdose prevention site legislation in the General Assembly for several years now, and we will continue to track it and continue to advocate that around the world. They are very effective. In New York City, they have been proving very effective in both reducing overdose deaths, virtually eliminating them among the clients of these centers, and increasing access to long-term treatment. You'll have an opportunity in the next legislative session to continue telehealth, phone-only telehealth coverage, which has been absolutely essential in reaching vulnerable populations experiencing homelessness. Phones are absolutely ubiquitous. Wi-Fi giving you video access is not ubiquitous. And we have been able to stay connected to people through phone-only telehealth. It was a lifeline during the pandemic, and it remains very important now, especially for behavioral health, but also for checking in and managing refills and keeping people connected to care. Operational funding for medical respite care, Medicaid expansion for everyone. It's working for people who are pregnant. Of course, people who aren't pregnant and do not have insurance are winding up in hospitals sicker than they would be if they got care elsewhere in the community. So often we talk about silos, health being health and housing being housing. And it was really the Medicaid Supportive Housing Waiver in Maryland that helped to break down those historic silos between health and housing. Ultimately, this became a 900-person statewide pilot. The federal government paid half. Maryland initially, when this was enacted in 2017, did not put up the match to draw down the federal funds. The different jurisdictions that participated, Baltimore, Prince George's County, Montgomery County, and Cecil, managed this in different ways. But in Baltimore, in partnership with the Mayor's Office of Homeless Services, we got to 300 households, and every hospital in the region contributed to draw down those federal funds. And of course, a 5-year study done by the Hilltop Institute found statistically significant decline in ED visits, avoidable ED visits, inpatient admissions for ACES participants. It proved what we know. Supportive housing improves health and ends homelessness. Director Simmons showed you a 5-year trend of retention in permanent supportive housing. And each year over the past 5 years, it was 95% or greater. And that's something that we saw in ACES as well. ACES is part of 19 active tenancy support waivers now throughout the country. This shows you where they are operating. 13 of them are specific to homelessness. And then you have 9 that are in various phases, negotiating with CMS or planning post-approval. And you see the number and the asterisk number are those that are dedicated specifically to homelessness. Maryland was a leader in this trend. And with your action, and the governor's action this year to fully fund the state match, this program is on track for statewide expansion, and the state Department of Health is negotiating with CMS right now. Want to talk a moment about our first steps into affordable housing development. I mentioned that happened in 2019. This is Sojourner Place at Oliver. It is, here it is completed. It's been operating for about 2 years. It is a 70-unit apartment building. Half of them, 35 units, are specifically for families and individuals exiting homelessness. The referrals for them come through coordinated access through the Mayor's Office of Homeless Services. The other 50%, the other 35, are affordable at 50% of area median income. Highly, highly affordable. With this project, we're working to prevent homelessness and end it at the same time. And through the development deal of this project, thanks to the Department of Housing and Community Development, we're financing services through the development deal. So we have no permanent loan on this building, thanks to the foundation community. Because of that, instead of paying banks over the next 40 years, we're paying social workers to help work with people to get them housed and keep them housed. Last year, we bought back our old clinic on Park Avenue. Some of you who may remember Healthcare for the Homeless, more than 14 years ago, we were at the intersection of Park, Fayette, and Liberty. When we left in 2010, that building has been vacant. We bought it back. You see in this bottom picture, Jill Steele and Shannon Snow, developer from HCH Real Estate Company, which is our real estate company, and Episcopal Housing, standing in front of the old Healthcare for the Homeless building. The city recently gave us access to 5 properties to the south, and another collaboration with Healthcare for the Homeless and Episcopal Housing, strongly supported by the city and the Mayor's Office of Homeless Services. 42 affordable apartments, 2/3 of them, 28, for people exiting homelessness. And we think it is just fantastic to be taking a former clinic site and converting it into housing, which, as I said, was the most effective way to end homelessness. And Director Simmons mentioned that Healthcare for the Homeless and Episcopal Housing and a third partner called Beacon Communities were successful in receiving the RFP to develop Sojourner Place at the Falls. You see on the left of this slide, the 2 hotels, the old Holiday Inn Express and the Sleep Inn, both of which are being used for shelter and will continue to be used for emergency shelter until we settle financing and start building. But on the right, you see that we would build in the parking lot in between them and connect to create 155 affordable units, 100 of them permanent supportive housing, and the rest affordable at a range of levels, and room for a 2-floor, 50-bed medical respite facility that the community will have the opportunity to plan together. I will end with this. Over the last 40 years, the dominant understandings of homelessness have changed. If we were testifying 25 years ago, Senator Carter, there would be leaders telling you that housing and health have nothing to do with each other. And the initial paradigm was homelessness as personal failing. What is wrong with you that you're experiencing homelessness? And we had federal policies that were a housing readiness paradigm for housing. In no other areas of human rights do we think about this. You don't have to be ready for food in order to eat or ready for clothing in order to wear them. My goodness, we'd have a lot of naked people running around. Why do we talk about housing as something that you have to be ready for? Housing is a right and something that you need. And this has shifted then into probably where we are now, the understanding of homelessness as systems failing. What systems are broken that we're seeing homelessness persist at such great rates? We think it's time for a third understanding. Think about all the data that you've heard about housing affordability, about wages, about access to healthcare. What else do we expect? To some extent, we are producing homelessness as a country faster than we are stopping it. And we have a kind of homelessness by design. And if we're going to accept that we have homelessness by design, asking ourselves, what do our systems and the way we fund them produce? How do we then change as individuals, as systems, as nonprofits? We're doing a lot of looking in the mirror these days to assess the extent to which we're participating in the very things we're trying to solve. But I'm so excited by the alignment that right here, Housing is Health, and are eager to work with the Office of Homeless Services, with the Department of Housing and Community Development, with members of the General Assembly to do just that, to end homelessness and not manage it. And thank you for the opportunity to present today.
Thank you so much for that thorough presentation. Committee members, I did goof a little bit, and I apologize to Carnitra White with Department of Human Services. I did skip over you unintentionally. I would ask if you would bear with us and please make your presentation now. And committee, take a breath, stand up, stretch if you need to, raise your arms, because we have one more short presentation, and then we're going to get to the questions I know all of us are anxious to get to. So with that, Ms. White.
Senator Carter, thank you so much. And I promise not to be before the committee long today, but I want to thank you all for this opportunity to share with you the work that we at the Maryland Department of Human Services do to play our part in ending housing security in Maryland. As we all, as the panelists before me have said, we all share a vision of a Maryland where every family has a safe place to call home. Next slide. And for the record, I'm Carnitra White, and I do serve as the Principal Deputy Secretary here at the Department of Human Services. All the work that we do here at the Department of Human Services is governed by the Moore-Miller Value Administration's, the Moore-Miller Administration values. I said that backwards. And you'll see by some of the things that I'll highlight today of how we're challenging the status quo and trying to be audacious and working with urgency as we move forward. Next slide. At DHS, we're committed to unlocking opportunities for over the 1 million Marylanders we serve. And we do this in partnership with nearly 6,000 team members across all 24 local departments of social services here in the state of Maryland. Next slide. So we are looking to address housing instability, and we believe that housing instability is not merely a statistic, but it is a lived experience that affects our neighbors, our friends, and our families. Excuse me. And we recognize there are many factors that contribute to housing instability, including economic insecurity, the lack of access to resources, and systemic barriers that perpetuate the cycles of poverty. And to combat housing instability and support families, we provide services that focus on strengthening economic security, improving housing access, and fostering family connections. We'll just stay at this slide. So I'm going to start by highlighting our Family Investment Administration's eviction prevention efforts through our Emergency Assistance for Families with Children program and our Eviction Assistance program. Both support housing security. First, the Emergency Assistance for Families with Children program provides emergency cash assistance to families who need emergency help paying their rent or utilities. And then our Eviction Assistance program assists individuals and families facing a housing crisis. Funding is available for a small one-time crisis grant to keep those facing eviction safely housed. And through this program, we also provide preventive services such as case management and counseling as an early intervention to prevent evictions. All of these programs are available through our local Department of Social Services, and together, these benefits supported over 3,000 Maryland families. Next slide. Between 2020 and 2022, 1 in 7 of Maryland's children and 1 in 12 employed adults and 1 in 16 people over 60 struggled against hunger. This intersection of housing instability and food insecurity is a persistent challenge impacting Maryland's children and families. Next slide. Here at the Department of Human Services, we administer the Supplemental Nutrition Assistance Program, or like we like to call it SNAP, because in the government we have to have acronyms. And this is our largest program. This is a federally funded initiative that serves over 382,000 Maryland households and provides over $2 billion in FY25 to help put food on the table of Marylanders. Also, for our programs, we also provide employment and training services, which promote long-term financial stability for those who receive both our SNAP benefits as well as our temporary cash benefits. Next slide. Sorry, I skipped one, and those are our direct assistance to families like SNAP and TCA has proven to lift people out of poverty and help build financial well-being. But thieves have denied families of that assistance. And in 2023, we worked closely with the General Assembly, advocates, and victims of theft benefit to develop a path to reimburse families whose benefits have been stolen. And as a result of this, we were the first state in the nation to implement a stolen benefit program. As of October 25th of this year, over $31 million in stolen benefits have been restored to nearly 48,000 households. Next slide. Many of Maryland children experience hunger in the summer months. Our recent success with the Maryland Summer Bucks program is another example of our effort to end child poverty and provide economic stability to families. We built the Maryland Sunbucks built our Maryland Sunbucks program on the Maryland Summer SNAP program by partnering with families, with the General Assembly, the Maryland Departments of Education and Health. Next slide. And we've leveraged 5.8 million in state resources to access over 70 million in federal resources. And those were dollars in the pockets of Marylanders in the summer months for children so that they could have summer food. Next slide. And we were able to serve nearly 600,000 Maryland children with food assistance this summer. This initiative alleviated hunger and supported local economies across all 24 jurisdictions through our automatic enrollment. So we didn't make people prove their eligibility through working with the school system. We were able to automatically enroll 99% of the Sunbucks recipients. Next slide. This initiative allowed us to serve 6.5 times as many customers in previous years, predominantly in Prince George's and Montgomery counties, and 10 times as many on the Eastern Shore. Next slide. This success underscores what can be achieved when we collaborate together and when we're innovative. Next slide. But I'll talk a little bit about, and I think my colleague Danielle also talked about children who experience the foster care system, and many leave our foster care system to housing insecurity. So by some estimates in the US, 1 out of 3 youth transition through the foster care experience. They have housing insecurity by the age of 26. We know that youth thrive when they live with their kin or their family of choice who are able to prepare and to support them and prepare them for adulthood. Next slide. And so with the enactment of the 2024 Senate Bill 708, Family Law Kinship Care, we've modernized our approach to prioritizing relatives as caregivers when children enter our foster care system. This isn't just policy, it's rooted in understanding that children thrive when they are supported by those who love them. In addition to economic security, we are also advancing a kin-first culture through our Family Matters initiative. I think we all, when we think about family, we all have that person or those persons that come to mind who supported us as we were growing up. And so we recognize the importance of keeping children connected to their families and connected to their community, and how that will help them thrive and have better outcomes, including housing security. So as part of this initiative, we will provide critical supports to family members, predominantly Black and Brown family members who step up to care for their children. This program was piloted in Baltimore City and will go into effect statewide in December. We will be ensuring that kinship care providers have resources and training they need in order to foster an environment where families can remain together and children can thrive, and we won't have to do separation. So I promised you I'd be quick. So in closing, our contributions to end housing stability in Maryland is a collective effort, and we believe in the collaboration and happy to work with many of our partners here. And together, we believe we can build a bright future for families facing housing instability. And thank you for allowing me to share with you DHS's contributions. I've been along a long time, so I was here when it was DHR. So thank you, Chair Carter. And I'll turn it back over to you.
Thank you, Principal Deputy Secretary White, and please accept my apology. I don't know how I goofed. You were actually the first person maybe here today, so I'm sorry I skipped over you.
No
But
worries.
Patience and your presentation. Now, committee, we are at the point in our briefing where we are ready for questions. If Delegate Bartlett is still here, I saw her hand earlier, and so I would, if she's still interested, I'd start with her. Other than that, committee members, you want to raise your hands and I'll call in the order I see them to ask questions of any of the presenters.
My hand was up accidentally, but I do have a question.
Okay.
I forget who presented regarding the 65% of older adults, and that's the fastest growing population for that's unhoused. I don't know if she also mentioned, I'm sure she did, what the specific targets or mechanisms are in place to try to lower those numbers. Thank you.
Yeah, that's probably a question for me. I think this is Danielle Meister from DHCD. So this is the first year we've actually had data to look at that breaks out older adults at such a deep level. And obviously, we're really concerned about the things we're finding. But I'd say in general, homeless systems don't have specific types of interventions for older adults, right? So we have permanent supportive housing, we have rapid rehousing, we have shelter, but it's built for the general population. And right now, there's a real lack across the state, and I would say nationwide, of interventions that are tailored specifically to the needs of this group. And so in particular, I think there's a couple of interventions we think are really promising, and we are working with the Department of Aging very closely. We meet weekly at this point to identify possible solutions. We have a collaborative grant we're working on, but there's a few things that are contributing factors. One is the home becomes unsafe for independent living. There's something that pushes them out of the home and into the homeless system. Affordability, rising housing costs when folks are on a restricted income or retirement income is extremely challenging. So one of the things, one of the gaps in interventions out there is a shallow subsidy program for older adults who maybe don't need a ton of supportive services to stay housed. They really need income. They really need a short, shallow subsidy to fill the gap between the rent bill that went up or their property tax bill that went up and their income, which is restricted. And so I think affordability for a lot of older adults is key. And then the other would be, adults who have maybe healthcare concerns as they're aging, they're having a challenge meeting their activities of daily living. That's another element as well. And the homeless system is not well built to serve them. So most homeless programs do not have skilled nursing as part of their model. They don't have sort of complex care, people who are certified to support people with the daily living tasks, personal care tasks. And so that's one of the problems we're trying to solve too. But I think in general, the root cause of that increase is skyrocketing housing costs against stable incomes. That's number one. And then number two is, folks who need I think in general, the population is growing, right? The demographics of our country are changing. There's the silver tsunami we all hear about. So as the population trends older, I think it's natural to assume that a bigger and bigger portion of people who experience homelessness will also be older. So it does mean that we have to retool our homeless systems and our homeless programs. We need to create interventions that are tailored to that population's needs. But there are a couple of unique and innovative programs out there. We're also looking at programs like home sharing, where there's for example, St. Ambrose's home sharing program in Baltimore City. They pair and pool, homeowners who need someone to move in and help pay the rent, and someone who's in need of housing, looking at how could we take a model like that and to create something specifically for homeless older adults. So we are trying to be creative in looking at different options, but I would say the root cause, in my opinion, is really the housing costs are outpacing income and the ability to reside there. But Kevin probably have a perspective on the healthcare needs piece of that.
I would just add, Danielle, I agree with every root cause that you identified there. The only one I would add is that we have significantly disinvested in housing support for older people. I was on a panel this morning with someone that I worked with about 30 years ago, and she was reminding me that the Mayor's Office of Homeless Services 30 years ago said, we're not providing services and housing for people over the age of 55 because housing is available to them. So we're connecting them to get into housing. Those resources are all but gone now with all of the other factors that you mentioned. On the healthcare side, I would just lift up a really interesting model pioneered by a woman named Sarah Zanton and team. She's currently the dean of the Johns Hopkins School of Nursing, and it's called Capable, and it pairs a nurse and a handyman with older adults in order to equip the home to allow people to stay there and to deliver intensive services in the home. And they're adding social workers to the model to help figure out the affordability problems, but it's something that's getting attention from CMS and may be featured in Medicare in the future.
And I'm glad you brought that up, Kevin. There was a slide in our deck that talked about our wins for the year, one of which is we did get a HUD grant this year to launch Capable in rural parts of the state. So we're working with the Department of Aging on that, and we'll be launching services in Garrett County, the Lower Shore, and Southern Maryland, with the goal someday to get statewide expansion. So
that's fantastic.
Yeah.
Okay, thank you.
Thank you very much. I'm going to call on Senator Benson, followed by Delegate Lehman. You're muted, Senator Benson.
Okay. Good afternoon. I want to thank all of you all for the presentation. I was at a place this morning called the Mission of Love. And the Mission of Love is designed to take in persons who are homeless on the street. They provide food, and they even have built a shower, and they have clothes there. Listen, I have yet, and I'm on the street almost every day talking to people and working with groups like this because I'm concerned about the homeless, the hopeless, and helpless. I have yet to find an individual who wants to be homeless. I think that we have failed a lot of our people, and I'm talking particularly about our African American males. We have neglected in providing the skills and the opportunities for these males or these people who are homeless to be made whole. That's a big problem. Economics is a big contributing factor to homelessness. And until we face, and I have not heard that really discussed here this afternoon, until it's more to it than providing a home. You have to provide the resources that are necessary to keep a person in the home. And that's basically what I'm personally concerned about, is that we have these companies, we have the unions, we have all of these people who are working, but we don't have the mechanisms in place to provide opportunities for these people to have the income that they need in order to stay in their home. I mean, they're not, when you talk to a lot of these people, they're not looking for a handout. They want an opportunity to go to work. And many of them, let's face it, are ex-offenders. And that's a problem. Even though we are saying that when a person fills out an application, that shouldn't be a part of the equation. But I'm telling you all, that is a problem. And I'm just hoping that we will get to a point where, in addition to dealing with people who are homeless, that we will also provide opportunities for resources to do what needs to be done. The other thing that I want to ask someone to comment on is, how are these different organizations and departments working together to ensure that people are provided the opportunity to have their own home? The social services, housing, these organizations that receive a lot of money, I don't see them working together to ensure that we do something really, really valiant and good to make these people whole. That's what I'm concerned about. Could someone comment on that?
I'll take it first, Senator. I think it's a couple of things for community though. When I think about who's on our streets and what are some of the needs, first, we don't do enough to instill hope, right? And so when we look at resources and support from access points, they're not coming accompanied with services that's going to let someone enter and feel as if, yes, I can sit here. Yes, I can get something to eat. I'm going to be able to get a bed, but I'm also going to get a case manager that's going to be able to provide me resources and support in time, right? Because sometimes what our providers are often struggling with is they're not funded in a way that's going to allow for a comprehensive intervention at the front door. What that means for us is the projects that I shared on my screen, HUD funds us largely for housing, but the supportive services, that's what you're speaking of, which is the need, that is not a funded element in our system. So we've also, in some ways, we've bypassed people and said, I'm going to offer you this one thing, but you almost have to be in position to take it, right? And that's not how we need to be treating people. We need to spend time with people and invest in them on the front door. And I think a lot of our presentations have lifted up where people end up. But what we haven't done a good job at is explaining is how our systems are not designed yet to meet them on their need. If I can't spend a couple of hours getting to know you, even though I might need something, that doesn't mean I'm going to trust you from the beginning. And clients that are experiencing homelessness, clients that are youth that are aging out of foster care, we don't spend enough time building trust to connect them to those resources that are out there. There are systems that are not connected. And I think that what's happening, at least from what I can see from the city's lens, we've been able to bridge gaps and bring rooms together that normally are not together. So they're able to start saying, I see myself in Kevin's project. I see myself in MOHS's shelters. And now they're coming alongside, but we've operated in silos so long that when you do that, you're only looking at what you're providing. And now in these conversations, like I should have mentioned for Kanitra's in that office, DSS is a part of my shelter system now. They're on the ground. They're providing resources. We are now taking advantage of each other's resources. But for Black men in particular, we're not spending time with them. We're not offering them services that they want to take advantage of, and we're not learning people. And so I think what you're hearing about case management and ACEs, all of these are now supportive services that's going to get them into housing, that's going to get them into employment opportunities. Because in the city, we have employment programs that are sitting vacant. They're not at capacity. They're not at census because we haven't invested on the front door of making people feel comfortable.
Thank you.
My opinion.
Senator, I'm going to move on to Delegate Lehman because we're approaching the 5 o'clock hour.
Yeah, I just have a really quick question, and it's probably a longer conversation another time, but my question is about whether any jurisdiction in the state of Maryland has a housing first policy. A couple of the jurisdictions in Northern Virginia do. And I just think it's so important. We're talking about, as Senator Benson said, all these other services. Healthcare is great, but people who don't have housing or are living on the streets, couch surfing, wherever they are, but especially if they're living outdoors, are so much less likely to be compliant with medicine. It's just such a big concern. I'd really like to see Maryland move in that direction, certainly at the local level, but also at the state level. Thank you.
So
Very
in
good.
Baltimore City, all of our COC programs are housing first. It is a requirement to be a part of our programs and to receive funding. You must be able to comply with housing first in Baltimore City.
And it's really a statewide requirement now. So so this dates back like 6-7 years ago, but at one point, homeless programs were scattered all across state government within different agencies, and they were all consolidated into DHCD in fiscal year 2019 under the Homeless Solutions Program. And so that's the program we administer. And any COC, which is all of them, that receives funding through that, they're required to do housing first for all programs. So there's a requirement for federal funds, a requirement for state funds. Now, where there's still a lot of challenges is with shelters that are privately funded. So the shelters that don't accept government funds, they're allowed to operate with whatever rules they like. There are no state laws. That's one of the reasons why the study required by HB 577 is really important. We're looking at how to fix that. But right now, a good chunk of the state shelters are privately operated, privately funded, and they can pick and choose who they admit, and they often are excluding people. But any resources that are organized through the continuum of care, which would be either state money or HUD funds, often local government, those generally are always going to be housing first programs. They don't always function at 100% perfection. So there are definitely challenges with the model and adoption, but as a policy, we are there. That is unquestionable. So
Would just note that the move from housing.
Great to hear that. Thank you.
Would note, Senator, that the move from housing readiness to housing first has been on a federal level very bipartisan in nature. It's happened under Republican administrations and Democratic administrations, and has been the central feature of the U.S. Interagency Council on Homelessness, calling on housing first policies. There was an attempt to change it in 2020, in the last year of the previous administration, and to completely undo that approach. Fortunately, that was immediately reversed in the next year and has continued. But I think we all know that elections matter. But Maryland has been a very strong adopter of housing first policies. And while we can always do more to cut across silos and work together, I would point out that everything we mentioned today involves a very strong partnership among everyone that presented. Each of these housing projects, the Medicaid supportive housing waiver, none of this could have happened without collaboration among DHCD, Mayor's Office of Homeless Services. Karnitra, I still call it DHR as well. DHS that is investing in resources. We have a DSS worker in our clinic sites, thanks to your department. And I think there's so much collaboration that's happening that perhaps in a future hearing we could lift up some of those collaborations even more.
Thank you. I have a couple of questions before we go, and I'm going to be very quick, and I'm going to ask for short answers because we can certainly continue these discussions offline. First, for DHCD, whether it's Ms. Meister or Secretary Day, I am Jill do-gooder citizen, and I have 2 vacant properties I'm looking to do something with, and I'd like to be helpful to my community and allow unhoused people to be sheltered there. What resources are available to help me make any necessary improvements or get approved for this type of service? And how do I get them?
Yeah, that's a great question. Frankly, there's not a ton of programs out there that can help an individual homeowner maybe make upgrades to the house to become a landlord or offer it for rent. But there are a lot of opportunities if you already own a property and it's up to code and you are ready to rent, or even just offer it as part of a program. We have most homeless programs that provide permanent housing, it's tenant based. So we actually rely on and need private landlords and property owners to participate. We have rapid rehousing programs. We have permanent supportive housing where the program will actually subsidize the portion of rent that a tenant can't pay, and pay fair market rent as a total. We have supportive services that come along with that. And those programs largely rely on the cooperation and participation of private landlords. So the fast answer is we have landlord relationships that are really important. We would welcome more of those. I think the harder, challenging question is, what kinds of repair assistance or bringing a property up to code. That's going to vary a lot by the local county and what kind of resources they have available. But we do support counties with developing those kinds of plans. So,
Thank you. Next question for Ms. White, I believe. You mentioned the pre-eviction support resources that you had. So I'm a mother of 4. I have $1,440 rent to pay. I'm 2 months behind and I have $200. Can I get help and how?
So that person would come to our local social services and ask
But-
for, but you guys can't hear me?
You're breaking up a little.
Oh, I'm in my nice state office. So let me just move closer.
There you are. You're good.
Is that better?
Yes.
Okay, so you would come through our local departments of social services. You would come in and ask for eviction prevention. You could also go on our website and our MD Think and fill out an application requesting emergency assistance for eviction prevention dollars. And they would be able to screen and determine whether your eligibility. It is a one-time grant that we provide to.
Could it possibly cover like the entire amount that the person's behind to prevent them from being evicted though?
It depends. It depends on the amount. There is a cap on the dollar amount. I don't have that dollar amount at the top of my head, but there is a cap on the dollar amount that we have. And oftentimes we work in partnerships. So when I was a member, when I served as the director of Anne Arundel County, we would also have our community partners who we would work with. So we may be able to pay part of the eviction notice, and then there would be our community partners who would also be able to provide. So we work in partnership and we help the families to navigate that so that we can support that eviction prevention. If we know that the next month and the next month that family is not going to be able to make that note, then that's when we begin to do the counseling and work with the family to talk about different ways and navigate other options for them so that you won't have a reoccurring eviction notice coming through. Happy to follow up more with you with links and caps on those programs. And we work closely with DHCD and their programs as well, locally as well, in order to prevent evictions.
Thank you. Final question, not really, but for now, for these purposes. Senator Benson talked about the formerly incarcerated and several of you mentioned racial disparities. And as you know, we over incarcerate Black people, in particular in Maryland. And this is data that we've known for a long time. What, if any, efforts are there currently to connect with the systems of parole and pre-release to help individuals that are being released transition into some stable housing from the point of release? How can that system be improved? And legislatively, is there something we should do this session?
Yeah, I can comment on that. So we have a relationship with public safety as well as DJS through the Interagency Council on Homelessness, where we're looking at this issue and what needs to be improved. The reality is there's not enough reentry housing options for folks that are coming out of incarceration. We also have some more systemic challenges around folks that are in pretrial supervision, and they just get released so quickly sometimes. The system doesn't even know they're going to get released. So there's kind of two pools of people. It's folks who have been incarcerated for a while, and we know the release is coming, and we can plan for it. We can create theoretically case management, reentry programs, housing programs to connect them to and link them to, so they're not exiting into the street. And then there's this group of folks who are maybe in pretrial, who are, maybe going to get released overnight because they no longer should be held or can be held. And so there's two different solutions there for those kinds of groups. But we do have ongoing conversations with both public safety and DJS about how can we improve those linkages. But I will be blunt that there is a lack of housing options that are specifically for people coming out of incarceration. And we don't have a whole lot of dedicated state funding to address that need. So we are looking at our own programs and looking at how we can incentivize that with our local partners. But the need is so great for people who are already homeless. It's very difficult to prioritize those dollars for people who might become homeless when they're released. So we really do need, I think, some dedicated state funding and housing options specific to that population, because we also know that they face a lot greater barriers. A criminal background and conviction history means landlords are a lot less likely to rent to you, means it might take longer to get employment. So the subsidy, the rental assistance might need to be longer for those households to help stabilize them. So the solution for those households has to look a little different, but we are working with both of those entities. DHCD is serving on a reentry task force to collaborate with public safety around reentry growth. And I think they're establishing a new division, things like that. So it's a budding relationship, but it is a massive area of need. There's a very strong link between incarceration and future homelessness. And then on the other end of that, people who are homeless are more likely to be incarcerated because of the criminalization of homelessness. So it is a cycle. I mean, they are interlinked issues, and it is something we're going to be taking a hard look at.
Thank you. I'm really interested in seeing what we can do legislatively, even if it's just make sure there's adequate information before somebody walks out of the prison. This is where you can go and where you can get some assistance. I don't know to what extent that happens, and we've talked about it before. It is 5:01. I'm not going to be responsible for holding people long. One more comment from you, Mr. Lindewood, then we're going to wrap up.
Thank you, Senator. I will send you a study that was done in Denver, Colorado. Our counterparts at the Colorado Coalition for the Homeless did a public safety compact where they built a 100-unit permanent supportive housing development with highly intensive services. And they worked with people that were immediately being released. And they housed 100 people directly from the prison system into housing. And there's a really wonderful study that was done of this that showed the public savings impact. And I'll make sure that
you read my mind, because the question I didn't ask is that type of a comprehensive facility possible, not just for the adults, but for the young people too. At any rate, with that,
I'll make sure you get that report.
I want to thank Secretary Day. I want to thank Danielle Meister. I want to thank Carnita White and Ernestina Simmons and all of the support staff that helped us put this briefing on today. All of the legislators, thank you and good evening.
Thank you, everyone. Enjoy your night.